Good afternoon to all of you on the East Coast, and good morning to you if you're on the West Coast. My name is Dr. Jose Leon. I am the Clinical Quality Manager at the National Center for Health in Public Housing, a project of North American Management. I want to welcome and thank you for attending today's webinar on outreach and enrollment. This webinar is being recorded, and the links and resources will be emailed to you after the webinar has finished. I would like to introduce our speaker for today's presentation. Our speaker is Jessica Kendall. She is the Director of Outreach at Enroll America, a non-profit, non-partisan organization whose mission is to ensure that all Americans are enrolled in and retain health coverage. Enroll America is a collaborative organization of diverse stakeholders, health insurers, hospitals, doctors, pharmaceutical companies, employers, consumer groups, faith-based organizations, civic organizations, and philanthropists, supporting an easy, accessible, and widely available enrollment process. Jessica works to identify best practices in outreach and enrollment and shares those lessons with partners at the national, state, and local level. Prior to joining Enroll America, she served as an outreach consultant focused on consumer assistance and Navigator-related programs. Ms. Kendall has been an invited presenter at multiple conferences and workshops to discuss best practices for getting children and teens enrolled and keeping them enrolled in Medicaid and CHIP. She focuses on capacity building, outreach, health policy, and best practices for enrolling individuals and families into health coverage programs. Prior to serving as an outreach consultant, Ms. Kendall was the outreach manager for Oregon's CHIP and Medicaid programs. There, she designed and led the outreach efforts to find and connect uninsured families with health coverage. She holds a Master of Public Health from Portland State University and a BA from the University of Southern Maine. At this time, currently 21.5 million uninsured non-elderly adults may meet the income and citizenship criteria to be eligible for Medicaid after the expansion. The 49% of uninsured low-income adults are in or falls in the less than 50% of the federal poverty line. 29% are in the 51 to 100% of the federal poverty line or level, and 21% are in the 101 and 138% of the federal poverty level. The percentage of uninsured low-income adults, 47% are white, 30% are Hispanic, 17% are black, and 7% are listed as older. Without further ado, I would like to introduce our speaker, Jessica Kendall. Thank you, Jessica.
Great. Thank you so much for having me today. I am so excited to be speaking with all of you. I was at a conference that some of you may have attended last July, I believe, June or May. It was last spring. So some of this information may be familiar to you all, but I hope to be able to share information with you and to answer any questions that you may have that will make it so that you're better prepared to talk to consumers about the health coverage options that are now available to them. So I want to start today, there we go, making sure my screen can move for you all. So I want to start by giving you a little bit of a background on who Enroll America is and what our national campaign is about, which is the Get Covered America campaign. I also want to discuss a little bit about what the last 23 days look like. I think that we've heard a lot on the news about what's been going on since October 1st, but I think it's important for this conversation to really set a baseline and a foundation so that as we talk about ways that you all can get involved and spread the word, we're standing on the same foundation. So I want to make sure that we get to that place before we start talking about strategies for consumers. So Enroll America is a national organization We have a very narrow mission, and we stick to it closely. And our mission is to make sure that Americans who are eligible for the coverage that's been made available by the Affordable Care Act learn about it and get enrolled into coverage. And we're really going about that through a twofold strategy. And the first one is promoting best practices. So for folks on the phone, some of you may be connected with housing authorities, other folks may be connected with health centers, some of you may be connected with health centers and housing authorities. But you have been reaching out to people, in the broad sense of the word, reaching out with them and helping them either apply for public benefits or get enrolled into programs or helping them navigate the system, whatever that system is. And what we want to make sure we're doing at Enroll America is identifying those best practices. What's worked? Have you helped people apply for CHIP or for Medicaid in the past? If so, what are those success stories? What systems did you put in place to make it easier for people to navigate the system? Because what we want to know is what's worked in the past. So as we enter into this new era, how can we make sure to take those lessons learned and apply them to now? And because the marketplace is now officially open, we also want to know right now, what are you doing? What are those success stories? What resources are out there? What have people done successfully to get people enrolled? And also, what are those barriers? Because if somebody is on the phone and happens to be in New Hampshire and is experiencing a barrier, there's a really good chance that somebody in Texas or North Dakota is experiencing something similar. So what are those barriers and what are those workarounds so we can make it easier for consumers to get enrolled? We also have a national campaign that I'll discuss in just a moment where we're using cutting-edge strategies. And our national campaign is called the Get Covered America campaign, which I'm going to be going back and forth language-wise between discussing Get Covered America and Enroll America throughout this presentation. Now, the way that we're going about doing all of this is by partnering with all of our stakeholders. On our advisory council, we have over 65 different partners, and we partner with many more around the country. This is a really small sample of the types of organizations that we partner with. But we partner with healthcare-related organizations, health centers, health systems, housing-related groups, employers, retailers, advocacy organizations, disease-related groups. If you have a vested interest in consumers getting enrolled into coverage for either financial reasons or altruistic reasons, we want to make sure that we're partnering with you. Now, because of our diverse partners, you may also see that if you put them in a room together, they may not all necessarily get along. But we all agree that consumers need to get enrolled into health coverage, and we want to make sure that consumers know those options are available. So what we're doing is we put together the Get Covered America campaign, and we're relying on those partners heavily, both in a handful of states as well as across the country where we're working at the state level and at the national level to make sure that we are having people involved in the campaign where you have neighbors talking to neighbors, family members talking to family members to spread the word that coverage is available. We're also continually modifying our work. We want to make sure that this is a data and results-driven campaign, that we are evaluating what are those best practices. For example, if you happen to be mailing postcards in Houston, Texas, who's most likely to respond to a postcard being mailed to them, and what language is the most effective? We want to make sure that we are evaluating our tactics and strategies to make this as effective as possible for folks. We're using earned media and digital media and paid media, and then we're also making sure that we are talking to consumers and having consumers step forward and talk about what their experience has been. Because we are a consumer-facing campaign, so Get Covered America is the consumer-facing campaign, and Enroll America would be a little bit more policy-heavy. It's where health centers would turn to for information. Consumers would go to Get Covered America. I would encourage everybody on the phone to go to getcoveredamerica.org to sign up for updates. If you happen to be in a housing authority or want information to tell your family members about or your neighbors, if you want information about what's happening locally, sign up at getcoveredamerica.org. Now, if you want to keep yourself abreast about the latest policy information and what you can be doing as an organization, sign up at enrollamerica.org for those updates. And one quick plug I do want to let you all know about is this weekend we are actually having a Treat Yourself to Coverage weekend. And we're going to be hosting over 300 events around the country this weekend. It's a national weekend of action on both October 26th and the 27th, with the goal really to get the word out to consumers about their new health insurance options. And if you or your organization wants to get involved and to either tap into something in your community or to plan your own event, you can email organizing@getcoveredamerica.org. So I keep kind of going back and forth between the campaign and the organization, and I'll explain a little bit more about why. So what you're looking at on your screen is where we actually have staff on the ground, those dark blue states. And in those dark blue states, if we ignore California, and I'll explain why in just a moment, but if you ignore California, those dark blue states tend to be federally facilitated marketplaces, which means that they also don't have as much money going into them as the state-based exchanges. They don't have in Texas or Florida, you know, the $40 million that California was able to dedicate to outreach alone. Texas and Florida don't have that. So what we are doing is making sure that we have staff on the ground who are going door to door, who are pulling together stakeholders, because there may be some kind of void in the state that actually has those tables of people being brought together. So we're making sure to connect the work that folks are doing to reach as many consumers as possible. Now at the national level, we have staff dedicated to every state. So for the light blue state, what we're doing is working with partners that are already working on this work. So for example, in Oregon and Washington, there are a significant number of stakeholders who have been talking about health coverage and healthcare reform for a very long time, who have been trying to put together outreach plans and really divvy up the state in a way where you can try to reach all of the consumers. I'm in Washington State right now, so where you can try to reach all of the consumers here. Now with that in mind, what Enroll America is doing is learning from those states. We have a staff person who's dedicated to Oregon and Washington and Montana and North Dakota and South Dakota and Idaho. And that person's responsibility is to learn from those states, to share those best practices that I mentioned earlier with the rest of the country. And when it's applicable and makes sense, to then also share back with those states what's happening in other places. So in some places we are pulling together stakeholders, and in other places we are sitting at those tables that have already been pulled together. Now for folks on the phone, what I would encourage you to do is to know that there are people in your community who are working on this, and maybe that's you or maybe that's one of your partner organizations. If you want to know who else is doing this work, feel free to shoot me an email and I can connect you with the right folks in your state to make sure that those connections are being made. It will take all hands on deck in order to make sure that we reach all of the consumers out there. Now what you can see here is if you look at where those dark red colors are, it just happens to overlap with where there's the highest number of uninsured in the country. So 2/3 of the uninsured live in just 13 states. The reason why I said we're ignoring California for this is California is doing tremendous work, and we have one staff person there that's really serving as a nerve center to take information about what's going on and to spit it out. But we don't have staff that are on the ground in California who are doing the work that they are doing in Texas or in Florida. I do want to acknowledge, though, that although there's a high number of uninsured in all of these red states, that doesn't mean that the impact of having the uninsured in other states is itself. So, for example, in Idaho, 20% of the adult population is uninsured. So 1 in 5 is going to be uninsured in Idaho, which has a significant impact on the state's economy, on the health of the state. So it's very important for us to make sure that people in Idaho are reached just like people in Texas are reached as well. Now, I wanted to pause for one moment and have you all identify which state you're in. And in case you're not familiar with the type of marketplace you're going to have, the dark blue is where you're in a federally facilitated marketplace. And what that means is that the feds are running the marketplace in your state. People would be going to healthcare.gov to apply for health coverage. And if there's an M on your state, it means that there's some kind of indication that you're considering a Medicaid expansion. The light blue is where it's a partnership exchange or a partnership marketplace, meaning that your state has decided to partner with the federal government to put together a marketplace. Or if it's red, it just means that you're going to be having a state-based exchange. So what does this actually all mean? What does it mean for consumers? Now this top line is for all the states out there that had an M on it. And what it means for consumers, and I must encourage you, please don't ever use the terms I have on this slide because they're incredibly wonky and they don't make sense to a majority of folks. But visually what I wanted to be able to show you all is that regardless of your income level, if you're in a state where they expanded Medicaid, regardless of your income level, there is a program available for you. It's either going to be a no-cost, a low-cost, or a full-cost program, right? You're either going into Medicaid where it might not cost you anything on a monthly basis, or you're going into the marketplace where you may be able to get financial assistance to help you pay for your monthly health insurance, or you can go into the marketplace and pay the full cost of that coverage. Now, for states that don't expand Medicaid, all of those options exist. However, there's going to be a population of people that can't get financial help and also can't go into Medicaid, and those are the folks that are actually extremely low income. What I want to encourage people to think about, because I think that it's easy to focus on that group of folks that won't have a coverage option, what I want to encourage people to think about is two things. One, before October 1st, they still didn't have a coverage option. States are continuing to choose to expand Medicaid. Ohio yesterday passed a bill saying that they wanted to expand Medicaid, right? So just because your state hasn't expanded it yet, that doesn't mean that they won't. And the other thing is human beings naturally exclude themselves. So what we want to encourage people to do is encourage people to apply for coverage. We want to encourage them to go to healthcare.gov and not automatically assume that there's not a program available for them. But if there isn't, if they don't have access, what I want to encourage people to do is also know where that health center is, where that place is that you can send somebody for help. It's definitely a shame that there's not a program available for people in a lot of states right now, but it is the reality we are living in, and a majority of consumers will be able to get coverage through the marketplace, so we want to make sure to spread the word that it's available. Now, regardless of whether or not your state decides to expand Medicaid, there's a handful of policy decisions that came with the Affordable Care Act that will make it easier for people to apply for whatever coverage options are available. So to go back and pick on Texas, although they have not decided to expand Medicaid, there are people in Texas who have been able to get Medicaid and for whatever reason haven't applied for it, haven't enrolled in it. And one of those main reasons from what we've seen is because there's a lot of barriers. There's been a lot of administrative barriers in multiple states that have kept people out of programs that they are eligible for. And what's happening moving forward, regardless of whether or not your state does a Medicaid expansion, is that some of those barriers are being removed. So rather than filling out a really long, complicated paper application that doesn't make a lot of sense, which is what a lot of the applications look like in a lot of states, there's now a single streamlined application. So people can still go to healthcare.gov and apply online. They're going to eliminate assets tests and eliminate in-person interview requirements, which also often serve as a barrier for people being able to apply. So it is getting easier. And for consumers, what that process looks like and what it should look like, and I say should because I'm going to go back and forth between a vision and the reality of what we're seeing. The vision is that there's going to be a single application, and people can apply online, over the phone, or in person, and that it will be a seamless and simple process. Now, depending on your state, that actually may be the case. In Washington State, people who apply via the Washington Health Plan Finder have had tremendous success getting enrolled into health coverage, and I'll discuss that more in just a moment, but it has been this really simple process. Now, for people who've been going to healthcare.gov, there's been a significant amount of frustration. It's been difficult to navigate, it's been difficult to get in, and there's been a lot of technology issues. I know that over the phone, it's been difficult because of the wait time. What we're seeing today is really different than what we saw on October 1st, and it's also going to be really different than what we're going to see on November 1st and December 1st and January 1st. So improvements are being made, although there has been barriers for people getting enrolled in the past. So when you start breaking down the fact that it's one single application, right, regardless of the program that you get into, you can apply online, over the phone, or in person. What I want to highlight here is that if people apply online, even with all the frustrations with healthcare.gov. What we know is people want health coverage, and they're excited about it, and they have been waiting for it, and they are ready for it. So if you go to healthcare.gov and apply, they can apply any time of day. You're not limited by when you can get application assistance, and you're also going to be able to get real-time eligibility. So on the hotline, there has been high call volumes, especially because of the issues that have come up with healthcare.gov. Hopefully that those call times, those wait times on the phone are going to be decreasing. I know that the plan from HHS is that they should be decreasing soon. However, as of right now, there's been a lot of frustration about it. I can't encourage you enough when having conversations with consumers to remind people to keep going back. The paper application is an option, and it meets immediate gratification, right? You help somebody fill out an application, or you fill it out for yourself, or a consumer fills it out, and boom, you're done, you filled it out. Well, you then need to mail it in. The chances of you filling it out incorrectly are significantly higher because it's a paper application, so it's not using a real-time logic to make it easier for you to complete. And then there's going to be a back and forth through the mail. So although it might be easier at this very second, that doesn't mean it would be easier than waiting another week. So I'd encourage people to stick with healthcare.gov or to use the hotline in order to apply. So let's be honest, how is it actually working? The dream and the vision is that it's going to be like that picture that you see on the left-hand side of the screen. How it's been in the past has maybe been a little bit more like the right-hand side of the screen. Now, depending on what state you're in, you might be experiencing either one of these images or something in the middle right now. As I mentioned in Washington, people have been able to apply on the Washington Health Plan Finder, and we've seen over 35,000 folks enroll. In Oregon, one of the success stories is that some eligibility changes that they made where they ended up sending out letters to folks that were on SNAP or on food stamps. They were able to reduce the number of uninsured in the last 3 weeks by 10%. So in 3 weeks, they were able to reduce the number of uninsured by 10%. In Arkansas, they sent out letters to folks that were on food stamps as well, and they had 55,000 people respond within a couple of weeks saying that they wanted to get health coverage. So it is working really successfully in a handful of places, whereas healthcare.gov has had some tremendous technical issues. We know from past programs, for example, the rollout of Medicare Part D, that this is to be expected. It's frustrating and it's disappointing, but it is to be expected. Medicare Part D was launched 3 weeks late and spent months trying to work out their technology issues, which I sincerely hope will not be the case with this. What we do know is that there are people all across the country that can provide application assistance. So when these issues come up, the more that you can connect people to trained experts to help consumers make it through the process, the more successful they're going to be. Because where we're starting is from this place of people not having any idea that their options are even available to them. So a year ago, Enroll America did all of this research looking at who are the uninsured. What do they know about the coverage options available for them? What do they need to know? Who do they need to know it from? How do they want that information to be communicated from them? What are those facts that move them to want to apply for coverage? And at that point, 78% of people had no idea that coverage would be available. Of those that would be able to get Medicaid, 83% had no idea. Now in August, the Kaiser Family Foundation did a similar poll asking that question, and 43% had no idea. But I think what this shows is that just because you make a program available, it doesn't mean people will apply for it, because you're not going to apply for a program that you've never heard of, right? I mean, it makes sense. And from what we've seen from other past public coverage efforts, for example, Medicare, or the rollout of CHIP, or the rollout of Medicaid, or even food stamps or SNAP, people don't apply for things that they don't know about, and it's only when there is a tremendous amount of outreach and marketing to spread the word that that program is available that people start to enroll. Now, over the last handful of years, there's been quite a bit of work done to get kids enrolled in CHIP, the Children's Health Insurance Program. And nationally, that success is at about 85%. Now, states that have actually put resources and put time and effort into reaching kids have been able to get to a less than 5% uninsured with their kids, simply because they reached out and spread the word that coverage is available. So what we're looking at is nearly 50% of folks still don't know about this. So there's a tremendous amount of people that we have to reach. Now, the numbers that are being thrown out there right now about how successful this is, or what do we do about this, or how many people are applying, are basically coming back to what you see on your screen. So in May, the Congressional Budget Office estimated that 7 million people would be enrolling in the marketplace. And I apologize, but I'm about to throw a whole bunch of numbers out at you guys. So to tell the story behind what you see on your screen is that over 40 million people are eligible for the coverage that's been made available by the Affordable Care Act, over 40 million. But 100% of people never do anything. So what the Congressional Budget Office also estimated is total over multiple years, a little over 30 million people will actually enroll into health coverage because of the Affordable Care Act. Now, what you see on your screen is that they also estimated that half of those people would enroll in the first year alone. Now, we have never seen, and here's the wonkiness coming into this, but we've never seen a 50% take-up rate in any other coverage effort that's been out there. But we know that people want health coverage. We know that from all of the research that's been done and from the tremendous excitement that we've seen, people want it. Healthcare.gov saw 8 million unique visitors in the first 4 days of open enrollment of this year. In the first 10 days, 14.6 million Americans visited healthcare.gov. So people are clearly excited to learn about the new options available to them, but I don't think that that correlates to how many are actually going to sign up for it. In Massachusetts, in the first 2 months of them opening up their program back in 2006, only 18,000 of the more than 200,000 potentially eligible people successfully signed up through the connector in the first couple of months there. So I think where people are at is they want to learn more. They want to shop around. They want to know about their options. And then we also know that most or half don't even know about their options. So what Enroll America did, was we took our research and we compared it to the other research that had been done up until January of 2013, so almost a year ago. And at that point, the Robert Wood Johnson Foundation, Blue Cross Blue Shield, CVS, as well as state-based exchanges, had done a lot of research on who are consumers. What do they need to know? And overwhelmingly, what we found is that people want health insurance. They want it. They think it's necessary. However, they feel like they cannot afford it. And if they can afford it, it's because it's not very good coverage. So there's a lot of skepticism out there. And I know that this is a long webinar where you're listening to my voice a lot. So the one thing I want you to take away from this webinar, right, with all of the information I'm giving you on the background, on where consumers are coming from, the one piece that I want you to take away are these 4 messages. Because these are the 4 facts that consumers need to know. So if you can pause for a moment and think about your position, your community, your family, and what do people actually need to know about the ACA? What do majority of consumers need to know? They need to know this. They need to know that the insurance plans that are available through the marketplaces will cover all of the care that they need. Now, I have a handful of examples out there, but depending on who your audience is, those examples can change. So for example, if you happen to work with women who have families, then letting them know that maternity care will be covered, and preventative visits, and prescription visits, and emergency room visits, letting them know that all the care that they need will be covered, and that they may be able to get financial help to help pay for that insurance plan. Because people think that it's not going to be quality coverage, so letting them know that it is, and they also think they can't afford it, so letting them know that they now can. And also, because so many people who are uninsured have had negative experiences with applying for health coverage, letting them know that they're not going to be denied because they have a pre-existing condition, even if they've been denied in the past, and that those insurance plans will cover the cost, and they'll show them, and they'll do it in simple language, right? It's not going to be tricky and confusing anymore. There's not going to be any hidden fine print. So it's going to be in simple language. Those 4 facts resonate with 89% of the population. So I'd also want you to think about, who are your colleagues? Who do they work with? How can you move message through your workplace? And how do you want to make sure that you're spreading the word to consumers that coverage is available? These 4 facts are what need to be moved through your workplace. And the majority of folks don't need to know a whole lot more than this. The one thing I would encourage people to know, though, that go beyond these 4 facts, is where you can go for help. Because what we did is ask people, great, you said, you didn't know anything about what was coming. We gave you these 4 facts. We gave you this information. And now you're telling us that you want to learn more. You want to apply for coverage. So we wanted to know how. And we also wanted to know, well, do you want help applying? And overwhelmingly, they said yes. 3 out of 4 people said they wanted help applying. I don't think that means that 3 out of 4 people will actually go get help. But what they want to know is that, is there somebody, is there a live person they can turn to? And when they know that, when they get it from their trusted source, then it gets them from that place of how they described feeling when applying for coverage in the past, of confused and overwhelmed and worried, to how they actually would like to feel when they're applying for coverage, which is secure, confident, and reassured. So these 4 facts and where somebody can go for help is the majority of the information that you all need to take away from this call today. Now I am going to transition and give you some outreach ideas and talk about how you can do application assistance. But really the message is think about how you can plug that information into the work you're already doing. Because if you're not already doing it, then I imagine it's actually going to be pretty difficult, because you all are really busy. You have really full plates, and you have so much work that you're doing that to add something else, I can imagine, would be a little bit overwhelming, right? So how you take those information, those 4 facts, and then spread it into your existing work, and then when possible, let people know where they can go for help. Now, to give examples of who can provide help, everybody you see on the right-hand side of the screen, all those smaller round dots, those are the folks that have traditionally provided application assistance in the past. You have these in every single one of your states. On the left-hand side of the screen, there's information about who can newly provide help based on the Affordable Care Act. Now, for Navigators, there may even be folks on the phone who are doing this, but this is a group that's mandated. So there are at least 2 Navigators, 2 organizations doing this work in every single one of your states. It's required because it's through the Affordable Care Act. And we put together this little chart to make it easier for you to remember that Navigators are supposed to make things easier. These grants have already been awarded, so they exist somewhere in your state. You can go to healthcare.gov to learn more. The key thing with a Navigator is they, 1, have to have expertise in Medicaid, CHIP, and qualified health plans. And qualified health plans are those plans that you would get through the marketplace. They cannot tell you this is the plan that's best for you. What they can do is help you think through what's important to you in a plan. Do you want to pay more on a monthly basis and less when you go to the doctor? Do you want to pay less on a monthly basis and more when you go to the doctor? Do you have a doctor or provider that you want to keep seeing? If so, let's find a plan that includes those providers. So they help facilitate the selection of a health plan. They also need to remain impartial. They can't have a bias towards a certain plan. They can't get paid by a plan. And they need to do outreach and education. Now there is another group on there called Certified Application Counselors. This group, and these slides are going to be available to you later so you can take a look through them, but what CACs, or Certified Application Counselors, do is they help people choose the plan that's best for them. So what they are, the criteria for being a CAC is a lot less than it is for being a Navigator. And the main difference in the different categories of that, these people who can do application assistance, is that there's money for Navigators and there's not money for CACs. Some states are looking into how to pay certified application counselors or CACs through foundation grants or through other types of dollars, so that does exist, but it's not one that is It's funded through federal dollars. But these people are doing application assistance. And if you are interested in becoming a certified application counselor, perhaps you're already doing this work. Perhaps you're a health center. You're already helping people apply for some kind of coverage program and you want to get trained. Well, then you can become a certified application counselor. And you can find out where there's certified application counselors in your community by going to this healthcare.gov and looking it up. Now, the good news is that there's been a tremendous interest in people becoming certified application counselors. Now, on healthcare.gov, you can sign up for the training and get training. The bad news is that because there's been a tremendous interest, from what I've heard, is there's a backlog. So because you sign up for training today, it does not mean you will get trained today. But I want to encourage people to remember that time is long, right? This help is going to be necessary for a very long time. So if you are interested in getting trained and you're not able to get trained this month or in the next few weeks, there's a lot of work to do. So even if you held on and got trained in a little bit from now, it's still going to be incredibly valuable in order to be able to make sure we're reaching consumers. So how can you actually reach out to folks? What can you do to help? Again, I can't encourage you enough to look at what you're currently doing and how you plug it in. But there's small things you can do, like hang posters in your waiting room or in your front offices where people come see you. You can put a voicemail that talks about those 4 facts and where people can go to apply if you have an on-hold feature. And you can also become a certified application counselor and make sure that all of your colleagues are trained on those 4 facts. So what are those best practices to actually make sure that you are reaching out to consumers, that you're doing it in a way that makes the most sense to your organization? Well, at Enroll America, we wanted to identify those common themes that we've seen in organizations that put together outreach plans that are successful and that reach out to folks. So first, identify your strengths. Who are you currently reaching? You know, there's such a wide variety of folks on the phone that I don't want to generalize, but think about who you're currently reaching. And if you happen to be seeing a patient, a client, a consumer, fill in the blank here, who else are they interacting with? Is there a stakeholder that you're partnering with? Is there a table that you're sitting at that's a coalition that also reaches out to your similar constituencies? Is there a way to spread the word? And also not to duplicate those resources. If there's another organization in your area that you partner with that's doing application assistance, how can you make sure that their work is coordinated with yours, right? Where do those clients come to you versus somebody else? And how can you target them? So prior to living in Washington State and working for Enroll America, I was the outreach manager for Oregon's Healthy Kids program, and there was a housing authority there, the Yamhill County Housing Authority. And what they decided to do was get trained as application, and this is for kids, as application assisters in Oregon. And I don't think they actually helped with very many applications. What they did do, though, is all of the families that lived in their housing complexes, they spread the word to all of them that there was a new program available for them to apply. So in Yamhill County, the Housing Authority played a really significant leadership role and spread the word. So although they were trained to do application assistance, that training actually gave them the background information to realize that might not be the best fit, but they spread the word to all of their different complexes. And then any place that they were attending a community event, they made sure to talk about the program in Oregon called Healthy Kids. So think about how can you be coordinating that work and spreading the word that coverage is available. And with that, think about who your target audience is. You know, for Enroll America, how we look at it, and we know that our target audience is busy, right? At least one person in each family is at least a full-time worker. 1 out of 4 uninsured are speaking a language other than English at home. And they're, Hispanics or Latinos are overwhelmingly represented. So it's really important for us to make sure that we are reaching consumers where they're at in the language that they speak and in a way that's culturally competent. So some tips for how you should target, or ways to think about how you can target, you know, your own clients or consumers or members or patients. You can see it on the screen. The one that I want you to consider is from our research, what we actually found is that a significant number of of the uninsured out there use text messaging, and they use it as a way to communicate. It saves money on their phone bills, and it's actually a trusted source of communication, and people open their text, right? People move, so mail is maybe not always the best way to reach people. But if you obtain express consent on forms, what it means is, can you have people agree that you can communicate with them via text? And if you're going to, one tip that we heard from the Michigan Primary Care Association is to consider reaching out to people at the beginning of the month rather than the end of the month. That way, you know they still have minutes left on their phone. Their data plans are still available. And you can send reminders and follow-up questions via text, obviously with people's permission and in a way that you're not violating any confidentiality. But it is a good way to actually communicate with people in a way that is the easiest for them to get the information you're trying to provide them. Now, we are in the process at Enroll America of putting together a how to create an outreach plan. We're going to be releasing 3 documents within the next couple of weeks. One is how to put together an outreach plan. Another is best practices for doing application assistance. And then the last is an Outreach 2.0 that talks about some of these slides in a little bit more detail. And if you sign up at enrollamerica.org, you'll be able to get the information as soon as we have it out there. But I do think thinking through where you want to be in a year from now, what role do you want to play in making sure the people you have access to are learning about the coverage options available and doing it in a way that you can count. If you don't count it, it doesn't actually happen, right? So how can you evaluate your work? And then also thinking through, well, what are those essential skills for your staff to have? If you have people who are going out in the community to either promote your programs or spread the word that coverage is available, having people who are outgoing, who are comfortable with public speaking, who want to go out there and network with strangers is actually a really different skill set than the person who's going to sit down and be very detail-oriented and help somebody fill out the application. Now, ideally, you can find those skills in the same person, but I think it's important to think of what are those skills and what skills do you currently have on staff. You know, if you're not going to be hiring new folks, which I think financially and capacity-wise a lot of people won't be, thinking through what do you want to be doing, and personality-wise, who are those people that would be the most successful at doing those roles. And then obviously use consumer-tested material, and I'm sure that you guys are all very familiar with this. But anything that you create, or if you currently have materials, or you desire to create some, there's been a lot of research that's been done to know what's the most effective way to put a message together and tap into those pre-existing or those resources that are out there in order to make sure that you are reaching people in the most effective manner possible. And obviously evaluate your work. I think when you put that plan together and you take that step forward and you start to spread the word, think about, is it working? How could you be doing it differently? How could you be doing it better? And when you do that evaluation, make those changes and then check it. See if it does make sense to expand that to a larger group. You know, if you happen to be a housing authority in a really large city, well, then perhaps it makes sense to do this in just a really small portion of your population or one region of your city, and then expand it once you figure out what the most successful way to reach consumers are. I wanted to leave you guys with some best practices. I think part of this can be applicable to consumer assistance, and other parts can be applicable if you happen to be a health center, housing authority, or somewhere in between, of how you can best make sure that people are showing up for appointments. You know, especially for application assistance, which I imagine can go into most of your work. For application assistance, making sure that somebody actually is there is really important because it's staff time. And I know that oftentimes, because the people we're all reaching have busy, complicated lives, that figuring out how best to navigate that to make the most of their time and yours will be essential. So we have some tips like giving them a reminder call, making sure they have transportation, which does not mean you have to provide the transportation, but if you give somebody a reminder call and ask them how they're getting to the appointment and they don't know and they don't have a car and they're not on a good bus line, then the chances of them showing up are significantly decreased, right? So during that appointment, you know, go slowly. This is complicated and people are so stressed and overwhelmed. So the more that you can build up that relationship with people, and this would be if you're providing that application assistance, but help them understand what it is that you've been trained on, right? And what it is they need to think through. What does insurance mean to them? This is going to be the first time for a lot of people to actually get health coverage. So making sure you're available for questions. And a lot of that will come from the training that you'll receive if you were to become a certified application counselor. Now, if you don't become that, that's great too. But making sure to connect them with one who is doing good work, who can help the consumers through the process, so that way they do get enrolled into coverage. We have some tips for in-reach and for outreach of ways you can spread the word. It is just as important to make sure that consumers know that coverage options are available as it is to provide that application assistance. All of you have access to stakeholders, to family members, to community members, to consumers. So the first step really is making sure that they know that they can go to healthcare.gov, regardless of their state, and go and apply online. If they are in a state that does not, that has a state-based exchange, and you don't know what it is and you don't know how to find out, one, you can follow up with me. Two, you can go to healthcare.gov and put in that you live in Minnesota, and it will take you to MNsure, which is the Minnesota Health Exchange. So lastly, I just wanted to highlight that whatever you guys decide to do, develop a plan, figure out who on your staff is going to implement that plan, right? Who are those personalities that's going to be the best at this? And if you don't have the funding to actually hire staff, that doesn't mean that you can't invest in staff with trainings, with information, with resources. And then look at what information do you currently have. If you're a housing authority or a health center, you already know the people's income that you're serving. So you can help them navigate the system a little bit more or figure out how to target them messaging-wise because you know what their income already is. And what are those easy, cheap ways that you can communicate with them? How can technology be your friend? And how can you make sure that those that you're seeing are seeing you as a resource, right? And if you happen to be helping them apply for coverage, how can you make sure they stay enrolled in coverage and also that everybody that you're working with understands the possibilities that are out there? So enrollamerica.org has a ton of information for you guys. If you want more, please let me know, or sign up at enrollamerica.org for more information. And with that, I'm going to turn it back to Jose to open it up for questions. Thank you.
Thank you very much, Jessica, for this outstanding presentation. We are going to move on. We are going to accept questions from the audience. If you have a question, please submit it through the question box on your control panel or use the hand raise icon and your line will be unmuted. Okay, Jessica, we have some questions. The first question says, where do people find the paper application?
Where do people find the paper application?
Yes.
Great question. I believe, and if I am incorrect, I will send an email that can hopefully get out to all of you to give you different information. I believe if you go to healthcare.gov, you'll be able to find out that information and that you'll be able to order a paper application.
Thank you very much, Jessica. There is another question. How are people hearing about the new insurance options available to them?
Great question. So unfortunately, or not unfortunately, but it depends on your state. So some states are doing a tremendous job spreading the word. If you're in and I'm going to name off a few states here, that doesn't mean that if I don't name your state that this information won't be out there. But if you are in Maryland or Minnesota or Oregon or Washington or Rhode Island or California, there's a tremendous amount of money being dedicated to marketing. There's TV ads that are up. There's radio spots. There's billboards. You know, in Washington State alone, in the Seattle area, there's going to be over 230 events promoting health coverage between now and the end of the year. So the states I just named are all state-based exchanges. Now, if you happen to be in a federally facilitated marketplace, there's quite frankly just not as many funds being put into marketing and spreading the word that coverage is available. In those states, if you're in a federally facilitated marketplace, you know, there may be TV ads, there may not. A lot of it is going to be through word of mouth and stakeholders. I think a lot of the information that we're seeing on TV and through the news media doesn't actually speak to consumers about how they can get health coverage, which means that it really adds to the layer of complication that's out there. From the Get Covered America campaign, we're spreading the word through social media, through staff on the ground, through partners, and we're trying to reach people in every way possible. But unfortunately, there's not enough information out there that's presenting the facts, which I think is why it's really important that we do all step in and spread the word to people that coverage is available where they can go to apply.
Thank you very much, Jessica. There is another question. What is the difference in training between CAC and Navigator?
Great question. So the Affordable Care Act pretty much created different categories. A lot of it can be associated with funding streams. Navigators are mandated. Every state, regardless of what type of state you're in, every state must have at least 2 navigators. Those are the rules. So some states have a lot, some states have fewer, but every state must have at least 2 navigators, and there's a set of criteria of things that they are supposed to do. And that's that slide that I showed that had the acronym EASIER on it, right? Like there's this mandatory set of things. They have to go through extensive training in order to do that. So put that in one bucket. Now, certified application counselors, they're not mandatory. And I think the online training that you can get from healthcare.gov is less than a 5-hour training. And your sole responsibility, you can do more, but your sole responsibility is to help people fill out applications. So I'm going to give some examples of who could do it. It is not an exclusive list, right? So who can become a certified application counselor is extremely broad. I think types of groups that are envisioned to become a certified application counselor would be hospitals, health centers. You know, it's those groups that have staff that are doing application assistance already, and this was the way, my interpretation, the way of making it so that they could help people fill out the application. They're not required. So one of the examples that we have, it's kind of like, for a certified application counselor, it's kind of like taking a first aid training course, right? Like you might go out every day and use your skills, and I took one when I was 20 and have never used them again. So just because you're trained doesn't mean you're required to do it. Navigators funding is directly tied to them helping people fill out the application.
Thank you, Jessica. We have one more question. How long does one have to get trained to become a CAC?
So I wish this answer was really simple. There's the federal requirements, and then there's the state requirements, and every state is different. I believe that the online federal application to become a CAC is a little bit less than 5 hours. That doesn't mean that your state hasn't put more requirements on there. So depending on your state would depend on whether or not you must receive more training. So some states would be satisfied with the federal training and other states may not be.
Thank you, Jessica. There is one more question. How many, I'm not sure if you have this information, but how many languages are your resources translated into?
Great question. So right now, Enroll America's resources that are consumer-facing, which I really want to highlight. So if you go to getcoveredamerica.org, that's our consumer-facing website. Right now we have our materials translated into English and Spanish, and I want to acknowledge that we are very cognizant of the fact that there are a lot more languages out there. As we've grown as an organization, that's all we've had the capacity to do thus far. If you go to enrollamerica.org, which is really that organization-facing website, so for example, those fact sheets that I mentioned are going to be coming out about the difference between different types of application assisters or how to do outreach. Or we have one right now that has, like, here's the facts about certified application counselors. Consumers do not need to know any of that information, so it's very targeted towards organizations. Everything on enrollamerica.org is only in English. The consumer-facing stuff we have created in Spanish as well.
Thank you, Jessica. We have one more question, and it says, can a CAC enroll patients?
I wish that that answer was as simple as that question. And I'm going to explain to you all why I say that. So, can a CAC enroll patients? A certified application, somebody who has been trained and certified as a certified application counselor can help a consumer complete the application in order for that consumer to get enrolled into coverage. And the reason why that is tricky is because, one, healthcare.gov, right? So that application is what would do the actual enrollment. And without knowing who your patients are, I'm hesitant to say that to say you can enroll patients, but certified application counselors can help consumers complete the application. A number of hospitals and a number of health centers are becoming certified application counselors or have staff that are helping patients complete the application, which I think is what the person was asking.
Thank you, Jessica. There is one more question. What happens if patients cannot cover their premiums?
What happens if patients can't cover their premiums?
Cannot cover the premiums. Is there like any financial assistance for patients or people who cannot cover the insurance premiums?
Based on your income would be the amount you have to pay on a monthly basis. Your premium is based on your income. So I think what we'll see is that there actually will be people out there who can't afford it still. You know, depending on the consumer and what their life is and where they live, because it's a whole lot harder to live on, say, $30,000 a year in New York City than it is to live on $30,000 a year in Nebraska, which means that, and please don't ever quote me because this is not the cost of a premium. It depends on how much your income is. But it means that $100 may go further in Nebraska than it does in New York. So I think there will be people out there who simply can't afford it. And even though based on the eligibility rules, it says that they can. So, you know, if consumers aren't able to pay their premiums, then they won't be able to have health coverage. Because this is private health insurance, because they will be actually signing up for a health coverage plan or health insurance plan. You know, it needs to be paid on a monthly basis.
Okay, thank you very much, Jessica. There is one more question. What is the Navigator training hours for federal and state level?
Great question. So federal and state are going to be different. If you're in a state-based exchange, I don't know all of the different hours. It really depends on the exchange. And everyone is really different. So, for example, in Washington State, they're doing a train-the-trainer model. In Oregon, they're doing an in-person training. In California, they're doing an online training. So it's very different depending on your state. What the federal government said for the federal training is that it would be no more than 30 hours. And I don't recall the exact amount for Navigators, but it was significantly less. Now, there are states out there that have said that people need to complete additional training. So I know in Wisconsin, there's additional training for Navigators in Wisconsin that has them do the federal training and then do another Wisconsin-specific training.
Thank you. Thank you, Jessica. There is one more question coming in. How exactly will the cost sharing work if consumers are eligible for it rather than tax credits?
That is a great question. On our website, we have information about this, and I say that because I can't give, I'm hesitant to give the policy answer for fear of saying it incorrectly. The one thing I'll explain just so everybody's on the phone, there's financial assistance for people based on your income to help pay your monthly payment. Now, if you're below a certain income level, which is 250% of the federal poverty line, so if you're below 250% FPL, which consumers will never know where they are, and if you happen to choose a silver plan, because there's different tiers of plans which really correlate with, do you want to pay more on a monthly basis and less when you go to the doctor, or more on a monthly basis, you know what I'm saying. So if you are below 250% FPL and you choose to get the silver plan, then there's also financial assistance to help cover when you actually go to the doctor. And that's what that person's question is asking. And I can't give the specifics to what that would look like, but it's applicable for certain folks who choose a certain plan.
Thank you, Jessica. I just want to remind the audience that this webinar is being recorded. And if you need a copy of the presentation, the National Center for Health and Public Housing will send this copy to all of the attendees for today's webinar. And if you have more questions or additional questions, please submit the questions to jose.leon@namgt.com, and I will make sure that Jessica receives all your questions. Thank you, Jessica, for this great presentation. We need people like you to keep us abreast on topics like this one on outreach and enrollment. I would like to share some resources with the audience. The very first one is a publication from Enroll America, the Health Center's important role in outreach and enrollment. And the Henry J. Kaiser Family Foundation has additional information. There is a publication entitled Providing Outreach and Enrollment Assistance, Lessons Learned from Community Health Centers in Massachusetts. And the Robert Wood Johnson Foundation also has additional information, Effective Education, Outreach and Enrollment Approaches for Populations Newly Eligible for Health Coverage. To all of our attendees, please complete the post-survey. This helps the National Center for Health and Public Housing to improve our webinars. And if you have any training and technical needs, please contact any of our talented staff members. Once again, thank you very much for attending this webinar, and thank you, Jessica, for this outstanding presentation.
Great. Thank you so much, everyone.